Why did the neuron break up with the muscle? Because it got tired of sending mixed signals. Now, that's just a little nerve humor to get us started. Welcome to our exploration into the fascinating world of nerve conduction studies, or as those in the know call it, NCS. At its core, NCS is a medical diagnostic tool used to evaluate the health and function of our nerves and muscles. Picture this. Our nervous system is like a vast network of telephone lines, with nerves acting as the wires that transmit signals from the brain to the muscles and back. These signals are what make it possible for us to move, feel, and interact with the world around us. NCS allows us to pick up the telephone, so to speak, and listen in on these conversations happening within our bodies. It's like being a switchboard operator in the grand exchange of the human nervous system, and trust me, the conversations are never dull. So if you ever thought of nerves as just cable wires in the human body, prepare to have your mind blown. Ever thought of running a marathon? Well, your nerves do that every single day. Welcome to the fascinating world of nerve conduction studies, or NCS for short. This ingenious procedure is like a marathon for your nerves. But instead of running shoes and hydration packs, we're dealing with electrical signals and synapses. During an NCS, doctors measure the speed and strength of a nerve signal. It's like a stopwatch at a race, timing how fast your nerves can send messages. This gives us a critical insight into how well your nervous system is functioning. Picture this. Your nerves are like a racetrack, with nerve signals as the runners. Each nerve is a lane, and the nerve signals are the athletes, ready to sprint at the drop of the hat. When the starting gun goes off, that's the electrical stimulus from the NCS equipment. These athletes don't run on their own. They need a relay team to get to the finish line. These are your nerve fibers, passing the signal along like a baton in a relay race. The faster the baton is passed, the quicker the nerve signal travels. But it's not just about speed. The strength of a nerve signal is equally important. Think of it as the stamina of our runners. A strong nerve signal can go the distance, ensuring the message gets where it needs to go. The beauty of an NCS is that it lets us see this race in real time. We can monitor the speed and strength of nerve signals, identify any hurdles or bottlenecks, and take action to get things back on track. So, the next time you're watching a race, remember, there's a similar one happening inside your body right now. Imagine being a detective, but your suspects are invisible and silent. That's what doctors do without nerve conduction studies, or NCS. Just like a detective unravels a mystery, NCS helps doctors to identify the culprit behind nerve-related issues. It's a high-tech sleuthing tool in the world of neurology, casting light on the shadowy world of nerve disorders. But why exactly do we need it? Well, you see, our bodies are intricate networks of nerves, each carrying vital messages from the brain to various parts of the body and vice versa. Now, imagine if these messages got delayed, scrambled, or stopped altogether. That's what happens when nerve disorders strike. Symptoms can vary from mild tingling sensations to severe pain or even paralysis. NCS is the tool that helps doctors to listen in on these nerve conversations, to figure out where the communication breakdown is happening. This is crucial because different nerve disorders affect different parts of the nerve, and the treatment for each can vary significantly. Moreover, NCS is not just about diagnosing disorders. It's also about monitoring progress and adjusting treatment plans. Sometimes it's used to rule out nerve disorders, providing peace of mind to patients experiencing unexplained symptoms. But perhaps the most important aspect of NCS is its ability to catch nerve disorders early. Many nerve disorders can cause permanent damage if left untreated. The sooner they are detected, the better the chances of preventing lasting harm. So, the next time you hear about nerve conduction studies, don't just think of it as another medical test. Think of it as Sherlock Holmes of the medical world, tirelessly working behind the scenes to solve the mysteries of the human body. So, NCS is not just a medical test, it's a detective's secret weapon. If NCS was a movie, it would be more of a drama than a horror. Now I know what you're thinking. A drama? Really? But stay with me. There's a common misconception that nerve conduction studies, or NCS, are painful and scary, like some sort of terrifying medical thriller. But that's not the case. Instead, imagine you're going for a massage. You're lying down, relaxed, when suddenly you feel a little zap. It's a surprise, sure, but not painful. That's pretty much what an NCS feels like. A series of small electrical shocks are applied to your skin, stimulating your nerves. It feels unusual, maybe a little ticklish, but not painful. And let's talk about safety. NCS is a non-invasive procedure. There's no need for any scalpels or stitches. The electrical shocks used are low voltage, so they won't cause any harm. In fact, the biggest risk you're likely to face is a bit of temporary tingling or numbness in the area where the test was done. Of course, as with any medical procedure, it's important to communicate with your healthcare provider. If you're feeling uncomfortable or if something doesn't feel right, let them know. They're there to help you and make sure the test goes as smoothly as possible. So, let's reframe our thinking about nerve conduction studies. Instead of viewing it as a scary, painful process, think of it as a necessary step in understanding our body's intricate network of nerves. It's not a horror movie filled with suspense and fear, but more of a drama, full of intrigue and discovery. And remember, the purpose of an NCS is to help diagnose conditions that might be causing nerve damage, so it plays an invaluable role in ensuring our overall health and well-being. It's a tool, one of many in the vast medical toolbox, that helps doctors provide the best care possible. So, if you're ever recommended an NCS, remember it's more of a feel-good movie than a horror flick. Sharing is caring, but in this case, sharing is also enlightening. We've journeyed together through the fascinating world of nerve conduction studies, or NCS. We've delved into its nerve-wracking intricacies, unearthed its purpose, and debunked the fears surrounding it. It's a procedure that's as intriguing as it is crucial, offering invaluable insights into the workings of our nervous system. Remember, knowledge about such medical marvels isn't just for the white coats in the labs and hospitals. It's for everyone. For the curious minds, the future doctors, or just someone who's keen on understanding the human body a tad bit more. And when we share this knowledge, we contribute to a broader understanding and awareness. So, don't keep it to yourself. There's a whole world out there, waiting to learn, to understand, and to appreciate the wonders of medical science. So, go ahead, hit that share button and spread the nervy knowledge around. You never know who might find it interesting or even life-changing. I hope you found this short video informational. For more information, visit neuroinlight.com, and please do the thing that's often asked. Like and subscribe. Thank you.